Hello, everyone. Today I will be talking about my interview with a mental health therapist who mostly works with people who have substance abuse issues. I interviewed this professional who currently works in this field to learn more about their education, their daily responsibilities, their challenges, and the impact the work has on helping people and their mental health. I will also connect what I have learned from this interview to the concepts that we have discussed in our course. The person I interviewed is a mental health therapist who works with individuals struggling with addiction or just their mental health in general. They have a background working at a mental hospital since 2013, and they also have a master's in social work. And their place of work is Cornerstone Healing Center. This place is a rehab center for those struggling with substance abuse issues. This therapist works for an organization that is a rehab center that provides treatment and counseling services for individuals dealing with addiction and mental health issues. The organization offers services for inpatients or outpatients, such as individual therapy, group therapy, recovery programs. Many of their clients that they work with are adults who are trying to recover from substance abuse and rebuild their lives. They also provide virtual therapy as well for patients that are doing outpatient therapy. According to the interviewee, becoming a mental health therapist usually requires a bachelor's degree in psychology, counseling, or social work, as well as completing licenses and getting certifications in their state. This process includes supervised clinical experience hours of around 2,000 to 3,000 depending on their state. So for a salary range for a mental health therapist can vary depending on experience, education, and their location. The average salary for my interviewee is around 80,000 to 120,000. Although experienced professionals may earn more, just depending on their position and location. Especially for an entry-level range, they will earn around 45,000 to 65,000, also depending on location. The demand for mental health therapists and substance abuse counselors is expected to grow significantly in the coming years. The need for mental health services and addiction treatment has increased, which means more professionals are needed to support individuals in recovery. This support will be in different ways as well. Virtual support has been growing tremendously as well since COVID. The therapist explained that their daily responsibilities include meeting with clients for therapy sessions, assessing their needs, developing treatment plans, and helping them to reach their recovery goals. They also work with group therapy sessions as well as working with family to inform them about substance abuse and questions they may have, or just in general whatever they need. Substance abuse therapists help support their clients' development in several ways. They help clients develop better decision making skills, manage emotions, and improve relationships. These strategies help clients build healthier habits and maintain recovery. And then my interviewee expressed her opinions on how to deal with patients' emotions, whether they may be hostile or anxious. They may not even know or understand how they may feel, and they may get overwhelmed. The best advice she had to deal with patients like this is to just give them space to be able to share their thoughts while also feeling validated. While you allow them to feel validated, also have some compassion and curiosity about how they are feeling without digging in too deep, so that way they don't feel too overwhelmed. The interviewee explained that several strengths that are important for this career includes empathy, patience, strong communication skills, compassion, discipline, emotional awareness, active listening. This Therapists need to be good listeners and supportive mentors for their clients to feel that they can trust them so they can open up more. My interviewee expressed that her most fulfilling aspects of the career is seeing clients make progress and regain control of their lives, as well as helping them to overcome their addiction while making progress and grow, while also making a positive impact on their life and their families. However, the job also comes with challenges. The therapist explained that working with individuals who struggle with addiction can sometimes be emotionally difficult. Relapse is quite common in recovery, which can make the process challenging for both the client and the therapist. She also shares that watching her clients allow their mental illness to run their lives instead of them trying to overcome it and grow from it is quite challenging as well. To manage the stress of the job, the therapist practices self-care and maintains a healthy work-life balance. They also rely on support from family, coworkers, and supervisors to discuss difficult cases and stay emotionally balanced. However, their main reliance is self-care, hobbies, and therapy for herself because therapists and counselors take on a lot of stress from their clients and they then need to decompress themselves as well. The therapist advised students who are interested in this career to focus on building strong communication skills, gaining experience, studying, counseling, patience, and some compassion. Some additional remarks that she had were that this field can be quite rewarding to yourself and your knowledge about people struggling with substance abuse and overall mental health. This career allows you to improve your community by improving overall mental health and awareness, while also allowing those who suffer and have dealt with mental health issues to heal. One of the most interesting things I learned from this interview is how complex addiction recovery can be. It is not just about stopping substance abuse, but also involves addressing emotional, social, and psychological factors. This interview helped me better understand the important role therapists play in helping individuals overcome addiction, as well as the importance for education and training to ensure that you will be able to understand your patients. This career connects closely to many concepts that we have learned in this course, including emotional development, mental health, and the importance of supportive relationships. Therapists help individuals improve their emotional well-being and build healthier social connections. In conclusion, substance abuse therapists play a very important role in helping individuals from addiction and improve their quality of life. This career requires strong interpersonal skills, education, and compassion. Learning about this profession gave me a deeper appreciation for the work these professionals do, as well as the challenges and rewards that this career may bring us. And then this is just the sources that I was able to use for my interview and my presentation. Thank you guys for listening to my presentation about a mental health therapist who works with substance abuse issues.